Now, around the world, people are having to adjust to wearing a face mask to limit the spread of coronavirus. They may help to keep us safe, but they also hide our smiles. So how can we adapt to a world where facial expressions are invisible? And what challenges could that pose for some people? Well, we can now go live to Canberra and speak to Dr. Jo Lane, a research fellow and clinical psychologist at the Australian National University. It's very good to have you with us. Of course, the world has changed in so many ways, and for people around the world wearing face masks, it changes the way that we communicate, Jo. But, in what ways does it really make a difference?
Yeah, faces give us a lot of information in our social interactions, and things like facial identity. So we recognise people by their face, and when we wear face masks, everyone looks the same. And as you said, facial expressions, we look at people's faces to see their mood or how they're feeling. And we also look at faces to help with speech. So we look at lips for lip reading. So that's all, different now that we're wearing face masks. But there's lots of things we can do. So for identity, we can use other cues like their hair or their voice, or I know some healthcare professionals are wearing name badges and photographs on their gown to see who they are. With facial expressions, that's a little bit more complex because we normally look at the whole face, and unfortunately we can only see the eyes. So from the eyes, we can work out where someone's looking and if they're engaged. But we need to be aware that some cultures find eye contact offensive. The other thing we can look for around the eyes, when someone's smiling and giving a genuine smile as opposed to a social or a polite smile, but when we give a genuine smile, we get squints around the eyes. So we can look out for that behind the mask. But we also have to do some more sort of cues around engagement. So the smile really tells us that someone's friendly and approachable. So we have to do things like have open body language, use more small talk, and nod to acknowledge the person. And for speech, that's a really complex one because people with hearing loss look at lips for lip reading, but we all look at lips in noisy environments and when our languages aren't the same as the person as we are communicating with. So it's important to go to a quiet location, talk clearly and slowly, and use simple language, and use interpretation devices if required. There are face masks that are clear, so we can avoid those issues, and they're good for people with hearing loss or language difficulties, or people who feel anxious in social situations. And one final thing, it's really important to smile behind the mask because smiling releases neurotransmitters in our brain that make us feel good and help us with our social interactions. And hopefully the person we're communicating with will see through our eyes and the squints around our eyes that we're happy to see them.
So it's all about talking with our eyes now, Jo?
Yeah, talking with our eyes. It has to be a genuine smile though. And also just using a lot more body language. So open body language, nodding, waving, a nice tone of voice. And if you're not sure how someone's feeling, just asking them, how are you feeling today?
OK, Jo, how do you say goodbye to me now with just your eyes then?
Well, I can give you a nice smile to thank you for the time today. And, I can wave to say goodbye.
OK, Jo Lane in Australia, thanks very much for joining us.
Thank you.